So in last week's email, we talked about the hip flexors. We talked about what they are first. They flex the hip, they bring the knee up to our chest. The main ones being the iliopsoas, or the iliacus, and the psoas. Psoas is the one that you hear probably the most about. The rectus femoris is actually one of your quad muscles, is one of them as well, but there's a lot of them out there. TFL, pectineus, there's a list of them, but the main ones you need to know about are the rectus femoris and the iliopsoas. Now, that being said, you'll hear a lot of times the psoas or the hip flexors being the main cause for back pain. And it can be, it may not always be. There's a lot of different reasons why we have back pain. The psoas just happens to get vilified probably more than any other muscle in the body for back pain. And don't get me wrong, I have seen it cause a lot of issues, maybe not always back pain, but even restrictions in movement, whether it become rotation restrictions, your inability to stay down in your swing, your inability to really drive off that back leg. The hip flexors can cause a lot of issues. So we're gonna go over some exercises that work on mobility for the hip flexors. The first one, mainly all I want you to do, just to kind of release and get the hip flexors moving, be near a wall, right? Or let's say you're on a golf course and your low back's tightening up. You can use this as a quick release to get things moving. You can hold on to the corner of a golf cart, all right? All I want to do is stay nice and tall. I want to bring my leg up. The higher you bring it up, the better. So try to bring it up to hip height. If it can't get that far, that's okay. Just do the best you can. All you want to do in this position is put your other hand on it, and you're going to basically push down with your hand and push your knee up into your hand. There really should be no movement, and you want to hold it for about 5 seconds. So just here, I'm pushing both of them into each other as hard as I can for 5 seconds. That may have only been 3, but you get the idea. Go for 5 seconds. Make sure you don't forget to breathe, and then maybe take a swing or two. Maybe you need to do it twice. Maybe you can do it on one side. Maybe you need to do it on both sides. But that's a good way to get things moving. Just start there, see how things move. And if you're noticing things move better, things feel better, now we have a pretty good idea that the psoas or one of the other hip flexors can be causing an issue. All right, so first exercise, remember, is just to get things moving nice and tall, pushing on your knee, holding it there 5 seconds. Do the other side, maybe you do them a couple times, but it shouldn't take, it's just 5 seconds at a time. 30 seconds, you do both sides twice, and things just move better. All right, so that's the first exercise. Second exercise, this is actually a great one to get the opposite side of the body working. When we want things to loosen up on one side, we want to generally activate the other side. So we're going to work on our glutes and our hamstrings here. Quick word of advice, pro tip here, people tend to have their hamstrings cramp, especially the first time they ever do this. So just be aware of that. Now, I have Amber set up here. She's sitting on the very edge of the table. Her feet are flat. If you're doing this at home, you can use your bed. You need to make sure that you are on the edge with your butt, all right? From here, Amber's going to lay back and let both of her knees come into her chest. All right, that's a nice comfy position. Now, she's gonna hold one knee, doesn't matter which one, with both hands. She's gonna let the other knee just relax and fall to the ground, all right? Here's where we get to have the fun, because that's a good stretch in the front of the leg, but we want to get more, right? So first thing we want to do is using our glutes, we actively want to think about taking this knee and trying to push it to the ground, right? It may not move a lot, but the glutes are active. You're going to hold it for a second and then let it go. You can do that a few times. Then after we do a few reps of that, we want to take it to the next level, and this is where the hamstrings come in, so be aware, don't cramp up. If you start to feel it, let go. You don't need it to just seize up on you, okay? So we're going to push down with the knee, then we try to pull the heel to the butt, we hold for a second, and then we let it relax. You just want a 1 second hold. Again, you push the knee down towards the ground, then you pull the heel towards the butt. You do that 3 to 5 times, and then you switch and you do the other side, and that's it. Literally just make sure you pull this knee in. If this knee is out here like this knee will not get as much, so you gotta make sure, and if you need to, you can grab behind the knee, on top of the knee, whatever's most comfortable for you. Then from there, it is knee down for a few reps, then knee down and heel to the butt for more reps. All right, that's it. You do that on both sides. We're starting to really get things moving. All right. Exercise number 3 kind of takes what we're just doing on the table up a little bit. You're going to get more glutes, but we're also going to be activating and moving the hip flexors. Okay. So the way this is going to work, we're going to lay on our back. We're going to lift our butt, making sure to tuck our pelvis. We don't want to feel like we have our low back arch. We want to tuck. Then, all you want to do from here is bring one knee into your chest, trying to maintain the height of the hips, and you're going to alternate your feet. Bringing the knee in to your chest. All right? If this is easy, I don't suggest marching with this one. You would lift your hips, put your leg out straight, lower the leg, trying again to not let the hips fall, and bring the leg back up. All right? And then you do the other side with this one. So you have 3 exercises. One you can do even on the golf course just to get things moving. That's where you stand and you push on the knee. All right? The second one is the hip flexor kind of stretch, but it's because you're activating the hamstrings and the glutes that are the opposite when you're on the table. And last but not least is the glute bridge marches or the single leg lowers where your leg is more straight while you're in a glute bridge. Remember to tuck that pelvis. We do not want our low back hyperextending because that kind of feeds into the dysfunction of the hip flexors. Hopefully you found this informational, and if you like it, please let us know what else you might want. Thank you.